Deep vein thrombosis (DVT) is a condition where a blood clot thrombus forms in a deep vein, typically in the legs, though it can occur in other parts of the body. The clot can block blood flow, causing pain and swelling, and in severe cases, can lead to serious complications like pulmonary embolism if the clot travels to the lungs. DVT is a medical emergency and requires prompt treatment. Causes of deep vein thrombosis (DVT) occurs due to a combination of factors, often referred to as the Urquhart triad, which include stasis of blood flow, slowed or reduced blood flow, prolonged immobility, sitting or lying down for long periods, such as during long flights, car rides, or bed rest after surgery, can cause blood to pool in the legs and increase the risk of clot formation. Paralysis, inactivity in the legs due to paralysis or long-term immobility. Endothelial injury, damage to the inner lining of the blood vessel. Surgery, especially major surgeries involving the legs or pelvis. Trauma or injury, direct injury to the veins from fractures or severe blows can increase clotting risk. Inflammation, conditions that cause inflammation of the blood vessels, like certain infections or autoimmune disorders. Hypercoagulability, increased tendency for blood to clot. Genetic clotting disorders, conditions such as factor V Leiden, prothrombin gene mutation, or antithrombin deficiency can increase clotting risk. Cancer, some cancers can increase the body's tendency to form clots. Pregnancy and hormonal changes, pregnancy, use of birth control pills, or hormone replacement therapy can make the blood more likely to clot. Obesity, excess weight increases pressure on the veins and can contribute to clot formation. Smoking, smoking can damage the blood vessels, increasing the risk of clots. Symptoms of deep vein thrombosis. The symptoms of DVT vary depending on the location and size of the clot. Some individuals may not experience any symptoms at all. Asymptomatic DVT. Common symptoms include swelling, typically in one leg or arm, especially in the calf. Pain, often described as a cramping or soreness in the affected leg, especially when standing or walking. Red or discolored skin, the skin over the affected area may become red or darker. Warmth, the affected area may feel warmer to the touch than the surrounding skin. Vein visibility, superficial veins may appear more visible or engorged due to the backup of blood. Complications of deep vein thrombosis. Pulmonary embolism (PE). This is the most serious complication of DVT. If part of the clot breaks off and travels to the lungs, it can block blood flow, leading to a pulmonary embolism. Symptoms of PE include sudden shortness of breath, chest pain which may worsen with deep breaths, rapid heart rate, coughing up blood, and fainting. PE is a life-threatening condition and requires immediate medical attention. Post-thrombotic syndrome (PTS). This is a long-term complication that occurs in some people after DVT. It results from damage to the veins and leads to chronic symptoms such as pain, swelling, leg heaviness, and in severe cases, skin ulcers. PTS can significantly impact quality of life. Recurrence. Individuals who have had DVT are at higher risk of developing another clot in the future. Diagnosis of deep vein thrombosis. To diagnose DVT, doctors may use several methods, including physical examination. The doctor will check for swelling, tenderness, or discoloration in the affected limb. D-dimer test. This blood test measures a substance that's released when a blood clot breaks up. Elevated D-dimer levels can indicate the presence of an abnormal blood clot, but other conditions can also raise D-dimer levels, so it is not specific to DVT. Ultrasound. The duplex ultrasound is the most common test used to diagnose DVT. It uses sound waves to create images of the blood flow in the veins and can detect clots. Venography. In cases where an ultrasound is inconclusive, a venogram, an X-ray of the veins, may be performed by injecting a contrast dye into a large vein to visualize the clot. CT or MRI scans. These imaging tests may be used to check for DVT in more difficult to assess areas or when a pulmonary embolism is suspected. Treatment of deep vein thrombosis. The main goals of treatment for DVT are to prevent the clot from growing, breaking off, and traveling to the lungs, and to reduce the risk of recurrence. Common treatments include anticoagulant medications, blood thinners. These medications prevent new clots from forming and stop existing clots from growing. Commonly used blood thinners include heparin, a fast-acting blood thinner that may be given intravenously or by injection; warfarin, an oral anticoagulant that requires regular blood monitoring to maintain the correct dose; direct oral anticoagulants. DOACs. Newer medications like apixaban, rivaroxaban, and dabigatran are often used because they don't require regular blood monitoring. Blood thinners do not dissolve existing clots but allow the body to naturally break them down over time. Thrombolytic therapy. Clot busters. In severe cases of DVT, or if a pulmonary embolism is present, thrombolytics may be used to dissolve the clot quickly. These drugs are more potent than anticoagulants and are typically administered in emergency situations. Compression stockings. Wearing graduated compression stockings can help reduce swelling, improve blood flow in the legs, and prevent post-thrombotic syndrome. These are particularly useful for preventing complications after the clot is treated. Inferior vena cava IVC filter. In certain cases where blood thinners are not an option, e.g., due to bleeding risks, an IVC filter may be placed in the large vein, the inferior vena cava that carries blood to the heart. This filter catches large clots before they can travel to the lungs. However, IVC filters are generally reserved for high-risk patients due to potential long-term complications. Prevention of deep vein thrombosis. Several strategies can help prevent DVT, particularly for individuals at risk. Stay active. Regular movement, especially during long periods of sitting, e.g., flights, desk jobs, can prevent blood from pooling in the legs. If traveling, stand, stretch, or walk every couple of hours. Compression stockings. Wearing compression stockings during long periods of immobility or after surgery can help prevent blood clots. Medications. For individuals at high risk, e.g., after surgery or hospitalization, blood thinners may be prescribed as a preventive measure. Hydration. Drinking plenty of fluids can help prevent blood from becoming too thick, reducing the risk of clot formation. Avoid smoking. Smoking increases the risk of blood clot formation by damaging blood vessels and increasing clotting factors in the blood. Weight management. Maintaining a healthy weight can reduce the strain on your veins and lower the risk of DVT. Risk factors for deep vein thrombosis. Several factors increase the risk of developing DVT, including prolonged immobility, e.g., after surgery or long trips; recent surgery, especially orthopedic surgery on the legs, hips, or abdomen; cancer or cancer treatments; pregnancy and the postpartum period; hormone replacement therapy or use of oral contraceptives; obesity; genetic blood clotting disorders, e.g., factor V Leiden; smoking. Advanced stage. Conclusion. Deep vein thrombosis is a serious condition that can lead to life-threatening complications if untreated. Early recognition and prompt treatment with anticoagulants and lifestyle changes can help prevent serious complications such as pulmonary embolism. Regular monitoring and preventive measures are essential for individuals at risk of DVT, especially after surgery, during long travel, or in those with chronic health conditions.